Alright, so this is our precious little girl here who is about to undergo part 2 of her cancer journey. And in this video, I'm going to talk about part 1, or we'll call it basically a prequel to the cancer journey that we're about to undertake. So last year in early July, I don't remember the exact dates, it was probably the very first week of July, I finally took her into the vet to get checked out because I discovered a lump. Unfortunately, and this part always pains me, probably a month went by or so that I was monitoring and checking on her left shoulder, or just behind her left shoulder. I was checking something that sometimes felt like a lump, other times I thought maybe it's just minor inflammation. It really depended on the way she's lying. Like for example, right now if she's lying like this, it's very easy to feel. Other times it just felt like normal muscle, and it was really hard to determine whether or not there was actually a lump there. And quick point that I'm going to make right now, obviously if you're watching this, if you find anything remotely suspicious, don't wait, don't hesitate, because that just will lead to such immense regret, which I have. I don't know how much 1 month could have made a difference to the ultimate conclusion to this story, whatever it's going to be, but obviously I have deep regrets about that. So we took her in. It seemed suspicious. The vet immediately noticed that some of the cells were a bit larger than others, and that kind of irregularity was suspicious. And it was sent off to lab, and it came back as a possible liposarcoma, which is a relatively aggressive form of soft tissue sarcoma. And the clinic where we regularly take her was pretty quick to move forward, ordered a CT scan. We were quite nervous. We don't like anesthesia procedures on our dogs, and certainly when it comes to French Bulldogs, that's an increased concern. But we went ahead and proceeded with that, and we had a CT scan done within days after that liposarcoma diagnosis came back. It was sent off for evaluation to a radiology center, and they actually came back with the potential of, they had determined that it could be a hemangiosarcoma, which is a terrifying diagnosis. It would have been a disastrous one. It was a horrible 3 or 4 days before we got a second opinion of sorts by moving forward with our own clinic, who relied on the fine needle aspiration results to determine that it was likely liposarcoma. And ultimately, in the end, it was. She proceeded with surgery. It was a moderately narrow excision, which means that they removed the tumor specifically, with some tissue in the surrounding regions in hopes of getting the tumor itself, and then getting some of the tissue around it that could be contaminated with some loose cancer cells. But unfortunately, because it was right behind the left shoulder, there would have been no way to get the wide margins that are normally recommended for a tumor of this type, which would be about 3 centimeters on each side. And this is where obviously the size of your dog is going to make a big difference. This was just too much for obviously a small 9-kilogram French Bulldog. 3 centimeter margins, just a little over an inch on each side. Probably not a big deal for a Rottweiler or a Doberman, but for a, generously speaking, a small medium dog, really a small dog. Sorry, I hate to tell you this, you're a small dog. For a small dog like this was a very wide demand, and as I said, with the proximity to the shoulder blade, it was not possible. But nevertheless, the surgery was successful. Thankfully, it was one of the most stressful experiences of our pet life. And when she pulled through without any problems, we got the phone call. It was a relief. I didn't sleep at all the night before, so in a way, I'll be honest with you, I was just, there was no big jumping for joy when we got the phone call. It was just kind of a groggy, okay, thank goodness. I mean, I was expecting everything to be okay. But when we went to pick her up, it was such a joyous moment. I remember she was sitting in a little ICU box. I actually had the iPhone with me, and I was recording walking in, but I guess maybe I was tired and maybe overexcited. I must have accidentally double tapped the record, and so I thought I was recording, but I wasn't. She was sitting in this little ICU box. It was just so charming, and she's just so incredibly tough. She was alert and awake, and she had this gigantic scar. Well, not a scar, a gigantic incision with stitches. It looked like something out of a Frankenstein horror movie, and a combination with a Darth Vader presentation in a Star Wars movie, because she had all these, I guess probably an IV and pain medication hooked up, and there was a box with some flashing lights right next to her, and she was just such a trooper, and it was such a joyous moment. And then we were shown some of the video from the surgery, very professionally done, to show us what they did. I don't really remember how closely I was able to watch that. That's something hard to see. And we were shown the tumor itself that was excised, including the soft tissue that was surrounding it, and obviously a horrible sight. But it was sent off to the lab for a biopsy, and about a week later, I don't remember the exact specifications, we got just such amazing news that the margins were clean, which means that there were no cancer cells found right in the near margins between the healthy tissue and the tumor, which is an indication that most likely the tumor is basically excised and there's no lingering cancer cells. Basically, it was an indication of a cancer cure. And that was fantastic news, obviously. We're thrilled, we're overjoyed with that, and we went on our merry way thinking that everything was okay. And this is where the story takes kind of a dramatic turn. If we're talking about prequels and using the Star Wars metaphors, this is kind of the bit of late episode 2, early episode 3, if you're familiar with it, when those signs start to show that Anakin is turning dark here, and mistakes are being made that's going to send him down the wrong path. That's basically what happened here. We went off thinking that everything was okay, and I take a lot of responsibility. I should have been doing the research afterward, but I think I was just numb from the whole experience and just relieved. But I should have done my research, which is that this kind of cancer diagnosis is not something that's one and done. There's no beating cancer. There's no declaring victory the way that I did, which I thought, and I even posted a video on her YouTube account that basically said something like, "You beat cancer." And some of the other videos I referenced it as well. Every time we talked about, oh, this was quite a year, you beat cancer. You don't beat cancer. You certainly sign a truce, and maybe it's an advantageous one, and maybe it goes on for a long time. But you should never think that you beat cancer. And we went on for months and months. We celebrated Christmas. We made fun videos. We had some fun activities. We had an advent calendar. We celebrated her birthday. We did a few trips. We didn't do nearly as much as I had hoped, and I really regret now that we're entering this phase, which is going to be another round of cancer fight that's going to include surgery and possibly radiation, and obviously much more in the works to deal with this particular tumor. But anyways, long story short, we're just living life normally and naively. But I am disappointed that our clinic didn't advise us better. I think we didn't go to an oncology center. We didn't go to a veterinary oncologist. We were dealing with our clinic, and they did a great job. They did the surgery. She was okay. But I think from their perspective, it was also over. For them, this was a surgery. They checked up on her. When the wounds healed, everything was okay. It was done. And what should have been told to us, was come back at least every 3 months to have an ultrasound of the region, the shoulder area, and that could have been checked. And what likely would have happened is that first 3 months, probably nothing. Everything would have looked all clear. But the second 3 months, when we would have been entering January, February, around then, perhaps an ultrasound would have detected a very small tumor. Certainly by April, May, if we had been going for those kind of 3-month checkups, what would have likely been detected is at least a reasonably sized tumor that would have definitely come up by then. Unfortunately, I started having doubts a little bit too late. I think I kind of woke up out of that numb feeling that I told you about. I was kind of numb after the surgery and just kind of, I don't know if you want to call it like an ostrich burying his head in the sand. I don't know what it was that I think deep down I should have known that, okay, this is a little too good to be true. We should be monitoring this, checking this. And finally, toward I think late May of 2026, I finally got suspicious and started checking, and it was very difficult because there's a lot of scar tissue here, so there's some bumps from the scars, but I felt that something was a little bit off, and we brought her in, and sure enough, they found a tumor, and I should say they found a mass. They did the fine needle aspiration once again, and it looked suspicious. Our vet told us immediately he was going to send it to the lab, but not to, basically said, don't get your hopes up. This is just a formality in essence. He knew that this would be the case given the location, given the history, and given the suspicions that he found by looking at those cells. And sure enough, the result came back, and yeah, liposarcoma once again. We decided to start seeking out some second opinions. Obviously, this is much more serious the second time around when a cancer returns. Doesn't matter which type. I think it's probably always going to be the case that there's a significant risk of a more aggressive form, whether or not it's a higher grade or just because of the nature of what happens when you do a surgery. There's a lot of enzymes that go into the healing process. That inflammation is actually kind of a perfect cradle for tumors to grow. So the second time around, this cancer may be more aggressive. We decided to seek out some second opinions, and it's good that we did, because initially the vet that we see regularly had found a tumor that was only about 9 millimeters in diameter, so that sounded very small, still under a centimeter. That sounded very good. The second opinion that we got from somebody who has a little bit more experience with cancer specifically found that it was actually double the size. According to his ultrasound, he saw and showed us very clearly a quite large tumor that was closer to probably around 1.8 centimeters, somewhere around 3/4 of an inch. May not sound all that big, but for a small French Bulldog like this, it's pretty big. And so we really kind of had to change our mindset and shift into high gear at first, because it seemed kind of small. We're told it's small when we look up everywhere for procedures, surgery, radiation. We're told, oh, under 1 centimeter, that's okay, that's very small, that's a great prognosis for the time being. And then suddenly it doubled, and now we're in that framework where if it's around 2 centimeters, now that's going to be a little bit more of a challenging surgery, certainly a little bit more of a challenging radiation protocol. And so that brings us up to speed. So in May of 2026, she was officially diagnosed with cancer once again. We now have some very difficult decisions ahead of us. We will be determining whether or not we need to proceed with a surgery coupled with a relatively new procedure that you perhaps haven't heard about, and I strongly recommend that if ever you're in this situation, you look into it. Make sure to ask your own vet or your own surgeon about electrochemotherapy. And that's something that's really frustrating, because it's something that could have helped her last year. It can be used as an adjuvant therapy for surgery like she had last year, that basically would have injected some chemotherapy medication directly into the site of the tumor, and then there would have been a one-time IV of that chemotherapy, and then they would have used basically small controlled electric shocks that force those cancer cells to open up and just whoosh, take in all those chemotherapy medications and close that in, and it's incredibly effective. And it would have been very useful exactly for what likely happened here, which is those stray cancer cells that are not removed surgically, that could have potentially made a tremendous difference. We may not even be in this situation at all. So if ever you find yourself with a diagnosis of soft tissue sarcoma, there's a few other cancers that it could apply to. Obviously I can't offer medical advice, and I'm not offering any medical advice, but all I wanted to say is make sure that you inquire about this and raise that with your vet, whether that would be appropriate or not. Whether or not that would be sufficient for a treatment, a course of treatment in this case, we got some mixed information. We got some mixed recommendations, but does seem a little bit skeptical, and so we are likely left with the more obvious options, which unfortunately one is pretty much unacceptable to us, which would be a radical procedure, a much wider excision. And as I told you last summer, it was already not plausible to have these kind of wide margins take that out. Basically what that means is most likely amputation of the front leg, possibly only the shoulder bone, but this would be such a specialized procedure that we just don't have access in this region to the kind of veterinary team that could maybe pull that off. For example, if you're in the United States and you're near a top tier veterinary program at a university, perhaps you could have something like that and feel confident that they could do such a surgery where they would have an orthopedic surgeon and oncologist working in tandem to perform this procedure, maybe. But to have somebody here who has some experience in cancer surgery, dealing with something as radical as removing a shoulder blade and preserving limb function, I feel very uncomfortable, which means we're left with really only one other option, which is at least something that is more standard and not experimental, and something that would most likely be familiar with those performing the procedures, which is simply a narrow margin removal, which means simply removing the tumor itself without removing lots of tissue, without cutting into bone or anything like that. Just get the tumor out, and then you use radiation treatment to knock out all those loose cancer cells that would be in the area. Instead of trying to cut out all the tissue and bone, you're going to basically try to irradiate them. Unfortunately, because of the proximity to bone, that's still going to be a problem, that if there's any cancer cells in the shoulder, well, you know, that's something that could be a problem. So that's the story of her first cancer diagnosis and the setup to what we're going to be going through in the next, I don't know, I'm guessing this is going to be a, I don't know, 1 month to 6 week process. We will be going to a specialized center that does have an oncology unit. I don't know what to expect. I don't know how, how efficient. I don't know how strong this program is, but I think it's unfortunately the best shot that we have. And we'll be looking most likely for that approach, which is going to be a standard narrow margin surgery with cancer, a standard narrow margin surgery with subsequent radiation, probably about 2 weeks after, once the surgical wound heals. So we're in for a long haul, because the radiation treatments are likely to be 3 times a week for something like 4 or 5 weeks. So I told you at the beginning that we are always uneasy about anesthesia for CT scans even, and I certainly am very concerned about radiation treatment that's going to require basically a full anesthesia. Well, I shouldn't say full. It's going to be light anesthesia, but it is real anesthesia. She will have to be put under temporarily to do each of those radiation treatments, because you can't have the dog moving even the slightest bit. So she's going to have to be under anesthesia 3 times a week for probably at least 4 weeks, maybe 5 weeks. And we'll keep you posted. So I'm going to try to make this a regular video series. I know if anybody's wondering, why would you do this when your dog is sick? And obviously this is not something to try to get views or clicks. I don't expect to get much I don't expect to get much viewership for this. It's not a pleasant topic. It's not those fun, cute dog videos. But my purpose is twofold. Selfishly, number one, I think it's a way for me to just process this. It's hard. She's such a central part of our life, and I know for those of you out here watching this that are, devoted pet guardians, whether it's a dog or cat or other. I'm sorry, that's rude to any of you who have a different animal to lump them all into other, but I hope you understand, the standard pets. We think about cats and dogs and others. You know how critical they are in your life, and how much they are just such a central part of your family. And so for us, the thought of, well, anyways, I'm not getting into that, but it's it's very difficult, and this helps me process that. And number two, I hope along the way, for anybody watching, and most likely if you're watching, I will just say I'm sorry that you're going through whatever it is that you're going through with your own pet. Most likely you stumbled on this because you're dealing with something, and that's why I decided to post this. I've been looking for information. I've been going through a lot of the clinical studies, and I've been going through a lot of the research that exists on these diseases, but I have struggle to find more direct personal experience. I do read, the comment boards sometimes about experiences with radiation for their pets, surgeries. So it's helped me, and I'm going to try to help directly by providing regular updates in person like this, and show some video clips, and I'm going to try to just document this experience, both as a way for me to just kind of deal with it. Hey, you, what are you doing there? Why don't you come be on camera? We've got another guy here. Hey, come here. Why don't you come here? Why don't you? There you go. Quit making those funny sounds. There you go. Why don't you put yourself on camera? There you go. There we go. So we're going to be documenting this. It's going to help me just kind of process all of this, but also hopefully it'll be helpful for anybody that is going through this or wondering what to expect. I hope that the coming videos will be able to offer that kind of information, or at least personalized information about what the experience is like, which of course doesn't necessarily mean anything. Our experience is going to be very different than the experiences that I've read about, and any experiences that you may have with this process will likely be a bit different, but it's still helpful, I think, to get at least some kind of baseline of what to expect, and hopefully along the way some of the information that I've come across will maybe be helpful. Like I said about the electrochemotherapy, radiation, those kind of things, I'll be talking about that. I'll be talking about what the vets tell me, and as I said, not medical advice, but at least give you some information that along the way you can raise with your own vet or your own veterinary medical team. So I think I'll stop here. So this is the prequel. We'll start the next video with a kind of, I don't know, I'm not sure, I don't even know where to start. It'd be so simple to say day 1, day 2. I'm not sure that I can do that, because in a way this is day 300, and I don't know, this is like day 340 or something like that since this all began. But at some point I'll have to find a way to label it for this particular I don't know, experience, this particular phase of the cancer journey. So that's it. Why don't you stand up? Hey, oh, there you go. Come here. Okay, there you go. Good girl. What a good girl. Okay, ready to sign off? Come here. Why don't you stand up? Come here. You. Let's look at the camera. Look at the camera. There you go. Okay, this is our big guy here. He's got his own medical problems, and I'm worried that we may have to do a different video series for him as well. We'll get into that some other time. But why don't you look at the camera? Come here. Look at the camera. Hey, there you go. Tongue sticking out guy. There we go. And then our special girl here. There we go. Okay. What, you want to come down? Whoa. Okay. All right. Thank you for watching. Take care, everyone. Morning. Okay, Mojave, come here. You stay. Okay, sir. No. Okay. Whoa. And you, Mojave, come here. Mojave. Come here. Mojave, come here. Good boy. Oh, can you get that for me, Mojave? Come here. Good boy. Sit. Okay. Good boy. Okay. No, not directly on the couch. Okay. Let's start the recording. Okay. Oh, look out. Okay, I'll try to keep it short. Okay. Okay, so this is a prequel. Mojave, come here. Hey, where are you going? Come here. Mojave, come here. Good boy, come here. You stay in the video. Come here. Right over here, Mojave. Come here. Good boy. And sit. Sit, Mojave. Good boy. Sit. Okay, good boy. All right. Okay. Want to get a treat? We'll get treats soon, okay? How about, give me about 10 minutes, okay? 10 minutes. You want to go get treats? We'll go get treats in 10 minutes, okay? Okay, good boy. You just stay there, okay? You stay there, okay? All right, we'll get treats very soon, okay?